When a patient is weaned from CPB, which of the following is an important consideration regarding fluid management? A. Administer a large fluid bolus to increase cardiac output. B. Monitor for signs of fluid overload or hypovolemia. C. Restrict fluids to avoid excessive urine output. D. Provide an unrestricted amount of fluids to avoid dehydration. Answer: B. Monitor for signs of fluid overload or hypovolemia. Explanation: proper fluid management during weaning is essential. Both fluid overload and hypovolemia can hinder successful weaning. Fluid balance must be carefully monitored to ensure the heart has adequate preload without causing excessive strain on the heart or lungs. What is the role of inotropic drugs during weaning from CPB in patients with poor left ventricular function? A. To increase blood pressure and reduce afterload. B. To enhance myocardial contractility and improve cardiac output. C. To reduce heart rate and oxygen consumption. D. To prevent arrhythmias. Answer: B. To enhance myocardial contractility and improve cardiac output. Explanation: inotropic drugs are used to enhance myocardial contractility, particularly in patients with poor left ventricular function, helping to improve cardiac output during the weaning process. These drugs are essential for supporting the heart until it can resume normal function. In patients with severe right ventricular dysfunction, which mechanical support device is most commonly used during weaning from CPB? A. Left ventricular assist device, LVAD. B. Intra-aortic balloon pump, IABP. C. Right ventricular assist device, RVAD. D. Extracorporeal membrane oxygenation, ECMO. Answer: C. Right ventricular assist device, RVAD. Explanation: in patients with severe right ventricular dysfunction, an RVAD may be used during the weaning process to support the failing right ventricle. This device helps maintain adequate pulmonary circulation while the heart recovers from the effects of surgery and CPB. When a patient fails to wean from CPB, which of the following is typically the next step? A. Immediate transplantation. B. Long-term mechanical circulatory support. C. Increase the heparin dose. D. Increase sedation and observe for 24 hours. Answer: B. Long-term mechanical circulatory support. Explanation: when a patient fails to wean from CPB due to severe cardiac dysfunction, long-term mechanical circulatory support, such as ECMO or LVAD, may be required until the heart recovers or a more definitive treatment, like transplantation, is available. What is a key consideration when weaning a patient from CPB who has been hypothermic during surgery? A. The patient should be kept hypothermic to reduce myocardial demand. B. Warming the patient too quickly may increase the risk of arrhythmias. C. The CPB machine should be used to warm the patient slowly. D. Hypothermia should be maintained to prevent fluid overload. Answer: B. Warming the patient too quickly may increase the risk of arrhythmias. Explanation: when weaning a hypothermic patient from CPB, it's important to warm the patient slowly to avoid the risk of arrhythmias. Rapid warming can destabilize the electrical activity of the heart and trigger arrhythmias. Careful, controlled rewarming is key to successful weaning. What is the most likely consequence of failing to properly wean from cardiopulmonary bypass, CPB? A. Development of infection. B. Acute kidney injury. C. Cardiogenic shock. D. Electrolyte imbalance. Answer: C. Cardiogenic shock. Explanation: failing to properly wean from CPB can result in cardiogenic shock due to the inability of the heart to resume adequate pumping function. This can lead to low cardiac output, hypotension, and poor tissue perfusion, which are hallmarks of shock. In patients with severe left ventricular dysfunction, what is the first-line treatment to support cardiac output during the weaning process from CPB? A. Use of vasopressors. B. Use of inotropes. C. Fluid resuscitation. D. Hemodialysis. Answer: B. Use of inotropes. Explanation: in patients with severe left ventricular dysfunction, inotropes are the first-line treatment to improve myocardial contractility and support cardiac output during weaning from CPB. These agents help enhance the heart's pumping ability and stabilize hemodynamics. What is the most critical hemodynamic parameter to assess when deciding if a patient is ready to be weaned off CPB? A. Central venous pressure, CVP. B. Mean arterial pressure, MAP. C. Pulmonary artery pressure, PAP. D. Cardiac output, CO. Answer: D. Cardiac output, CO. Explanation: cardiac output is the most critical parameter to assess when determining if a patient is ready to be weaned from CPB. Adequate cardiac output indicates that the heart is functioning effectively and can take over the role of systemic circulation from the CPB machine. Which of the following is the most appropriate method for confirming that the heart has adequate perfusion during the weaning process? A. Monitoring central venous pressure, CVP. B. Assessing arterial blood gases, ABG. C. Measuring mixed venous oxygen saturation, SVO2. D. Using a pulmonary artery catheter. Answer: C. Measuring mixed venous oxygen saturation, SVO2. Explanation: mixed venous oxygen saturation, SVO2, is a valuable indicator of oxygen delivery and utilization. During weaning from CPB, an SVO2 value that remains stable or increases indicates that the heart is adequately perfusing tissues, which is crucial for successful weaning. Which of the following factors can most contribute to successful weaning from CPB in a patient with known coronary artery disease, CAD? A. Ensuring normal sinus rhythm. B. Increased use of anticoagulation. C. Adequate coronary perfusion pressure. D. Administration of high doses of diuretics. Answer: C. Adequate coronary perfusion pressure. Explanation: adequate coronary perfusion pressure is essential for patients with coronary artery disease to ensure that the heart receives sufficient oxygen during weaning from CPB. Poor coronary perfusion can lead to ischemia and heart dysfunction, making weaning difficult.